Thank you, and welcome to you both. I don't know how much you were able to hear backstage, but we've just spent the last half hour talking about the search for a cure to Alzheimer's, the race for cutting edge pills, technology, early detectors, trying to figure out how you prevent somebody from getting the disease. And we're going to pivot now that you've joined us to talking about, I described it as the flip side of the coin. There's the race for the cure, and then there is the figuring out how you help care for people who are suffering from this disease now, and how you help care for the people who are caring for the people who are suffering from this disease now. So Dwayne and Tiffany, thank you so much. And Tiffany, you have both dealt with this in your own families, and I'd love to hear some of your stories. You've also written about this as a journalist for the National Journal, and I wanted to use something you wrote to frame our conversation. You write, and I'm quoting, "Lost too often in the discussion about a cure has been a more basic, more immediate, in many ways more important question. How can we better care for those who suffer from the disease?" And you go on, "Dementia comes with staggering economic consequences, but it's not the drugs or medical interventions that have the biggest price tag. It's the care that dementia patients need." So Tiffany, if I may, let's use that as a leaping off point. I know as you reported this big story that you did for the National Journal, you were living through this with your family. You were learning very quickly how Alzheimer's coverage varies state by state. Medicaid can help, Medicare often doesn't. Can you give us a sense of the landscape in terms of care options and how much help people are getting with those?
Yeah, I think when I became a caregiver, it was a bit of a crash course in what to do. My dad had been taking care of my aunt for 7 years, and when he became too ill, with a lot of the stress that comes with caregiving, I took over. And
you were 29.
I was 29, and so
caregiver for both of them.
Right, and which I think is a very common experience you hear with caregivers when one parent's been the caregiver and the other suddenly can't do it anymore. So I was shocked that Medicare and Medicaid really don't cover kind of long-term care cost in the way that I think a lot of Americans believe. And I think there's a poll that I quoted, it was something like 40% of Americans over 40 don't realize, that long-term care isn't covered by Medicare. And we kind of found ourselves in that middle where my aunt didn't have enough money to really pay for assisted living or skilled care, and she also wasn't technically sick enough to qualify for skilled care, so she needed either nurses at home or she needed assisted living. And we sort of reached that stage where she needed more care than we could provide at home, but we couldn't really afford the quality care that we wanted, and there weren't a lot of public supports.
Yeah, you described a moment in the article that when your aunt, Jackie, reached age 65, you kind of breathed a sigh of relief thinking, oh, thank God Medicare will kick in. And you sat there in a hospital with her and had a social worker explaining, actually, there's nothing medically wrong with her. And
yeah, and I think the social worker probably, she's probably given this speech tons of times. But there I was thinking, oh, well, she has early onset Alzheimer's, so those first, 6 years were really tough financially, but now she's covered. And the social worker said, she needs what's called custodial care. She needs help with bathing, with dressing. She needs a sitter. She doesn't need IVs and what an RN could provide. And so she kind of took me through, like, this is what this covers, this is what this covers. And here I'm thinking, okay, well, we're getting discharged in 3 days, and I have no idea what I'm going to do with her.
Dwayne, this is something you are living with and dealing with every day. We mentioned your mother is 92. Yes. She suffers from Alzheimer's. Tell us her name and a little bit about her.
Flora Hughes is my mother. I moved her up from Jacksonville, Florida in 2004.
Okay.
I had a call from a trusted friend that said, your mother needs help. So I went in and packed her up and moved her up to my place.
And you were living here?
Yes.
And moved her, and you had a home where you had another bedroom where she could get set up. And tell us, she's been suffering from Alzheimer's for 10 years.
Yes.
What is a typical day like caring for her? What does she need?
Well, she needs minimal supervision. It's hard to tell, as we were discussing earlier, about what we know about the different stages and how much care needs to be given. She seems like she's still in stage 1. I have to get her up. I have to make sure her hygiene is taken care of. But other than that, she pretty much gets around pretty good.
How does that work with your own work? You work a night shift.
Yes.
And is that because of your mother? Your responsibility?
Yes, I can be there during the day, and she also has PCA services personal
What's
care
that?
assistant that comes in.
What do they do?
They stay there with her, make sure she gets her medication, make sure she eats, prepare her food for her, take her out every now and then.
In terms of what kind of help or guidance you have gotten from various federal agencies, from your health provider, tell us what that process has been like as you've gone through it.
Right early on, I thought I had to do everything myself, and
Yeah.
I got to be a little too much, but my mom did qualify for DC Medicaid and Medicaid as well, which pays for the assistant to come in,
Right.
which gives me a lot more time.
You must have a network that helps you too.
Yes.
Family
yes.
and friends
Family
around.
and friends.
Church.
Church, my community.
Yeah.
Yeah.
You described a dramatic moment. You were trying to work full time. You lived here. Your aunt was it South Carolina?
Yes.
And you tell us about that moment where you realized she's going to be released from the hospital in 3 days, and I have no idea what to do.
Yeah. And we kind of, I had an extended support network really on my mother's side, but on my father's side, it was just my aunt and my dad. And so I thought, well, this is it. This is me. And so you kind of have to juggle, am I going to quit my job? Am I going to move back home? Something I'd worked so hard to get to DC, to have a job, to be working as a journalist. And you think, well, all that could just disappear in a moment if I'm going to be a full-time caregiver. So you're trying to balance, who's going to pay for some of the needs that she has if I do quit my job? And I think it's something that a lot of caregivers struggle with, and especially when you're on the younger side or you're in the prime of life, if you're in your 40s and 50s, trying to decide how to both continue your career and set aside assets for your own retirement while also caring for someone. And when we were in the hospital, I just thought, I need to get her somewhere safe, and I need to figure out, I'll figure out the money situation later, but you're in survival mode. And I think unlike some families, we didn't have a big plan. I kept telling my dad, we need to decide, at some point, she might get too sick for you to keep her at home. She might get too sick for you to come back and forth from work and check on her. What are we going to do then? And unfortunately, it took a crisis point where he, was hospitalized that we kind of had, and she was hospitalized at the same time that we had to make that decision.
And, you made the decision, a difficult one, I'm sure, to put her in an assisted living facility, which costs several thousand a month out of pocket. If you're looking at a nursing home and the attenuant medical care, you're just heading up in terms of cost from there.
Definitely. And I think one of the things I found at least, was that it was hard to find quality care. I think the assisted living facilities are kind of meant as a stopgap before skilled care. And there are some that really specialize in dementia. But the first one that we tried, the first facility, we really based it on the price. And we thought, well, they're saying that they have a lot of patients with dementia. The price is much less than some of the others. But we really found that she wasn't safe there, and they didn't provide the level of care. And it was a much more stressful situation. I think people talk about the rollerboard generation, where I was in DC, so I get a call in the middle of the night, and I'd send, my cousin or my mom or my aunt on the other side of the family, like, can you just go over and see if she's okay? Do I need to come home? And kind of doing that every few weeks, flying back and forth, it takes a toll, even though you're not doing the actual physical labor like my dad had done before.
Dwayne, tell us, in terms of, as you've watched your mother for 10 years and helped her through this disease, where are you getting information from in terms of what resources you have, in terms of knowing that there's a helper who can come in during the day and keep an eye on her, make sure she takes her medicine? Have you had somebody who's helping you coordinate all this? Or because I'm imagining you don't have that much time trying to take care of her during the day and then work the night shift at night.
Well, initially, when I moved my mom up, I just tried to absorb all the information I could by going to the social services, asking them what was available and what I needed to do.
Walking into the office and saying, I need help.
Exactly, walk just like that. And then I joined a support group.
Okay.
And got to talk to people who had already been through the process and had care for their loved ones, some to, end of life. And that's how I learned to maneuver and get the things that she needed.
Is there something specific that would have been really useful to know 10 years ago when you started this process that you now know that you didn't then?
Yeah, the help's available. Like I said, I thought I had to do it all myself and realized that I couldn't. It just became too much. But to start the ball rolling, with social services, with my neighbors, joining a support group, and I've learned a lot with those people as well.
It's a full-time job for you.
Yes.
To keeping on top of all this. I mean, you described, Tiffany, in the article you wrote, a line that had me just cheering for you, where you said, what I needed most in all of this as a caregiver was was pretty simple. It was just access to an expert to help navigate the system. And you said, I don't care if it's a doctor or a nurse or a social worker or like, but just someone where I'm not trying to take all this on myself.
I think, and I especially think about it in terms of what Dwayne was saying, I wish my dad had known sooner, or I wish I had done the research sooner to know that he really didn't have to do it by himself, and that, you know, and then when you're put in that survival mode where you're just trying to make any decision, you feel like you don't have a lot of time to go around to different agencies, and you kind of want a point person to just say, this is where you need to go, this is who you need to call, here's the person that can help with your benefits. And I think too often, I would hope that primary care physicians and nurses could be that stopgap, but I think there's a gap in their knowledge about Alzheimer's and resources, and they're busy and they don't have time in that primary care appointment to walk you through things. So I wish I had been more of an advocate, I think, earlier on to find those resources.
I mean, it sounds like you didn't know some things that would have been really useful to know, like that your aunt was eligible for military benefits.
Right.
She had been married to a Vietnam War vet, and had that been getting paid all along, that would have gone a long way toward paying toward assisted living and eventual medical care. As you've both lived through this, I mean, this seems like something that's not easy to address, but it's a whole lot cheaper than cutting-edge pharmaceutical research in terms of where federal money is directed. Are there specific things, you know, you talk about just having a point person would have been really useful. How about for you? What would have been useful, or what would still be useful as you try to balance having your own life and taking care of a mom who you love?
Well, with the Office of Aging, I would think that they would have been a little more, I guess, proactive. 'Cause I'm coming to them saying, you know, this is my situation, and having to ask the right questions, and hopefully they could push the process along. Like you were saying, to find a doctor. When my mom got up here, that would say, okay, your mom does have dementia. Here's where you need to go, what you need to do.
Okay. Okay. And from your point of view, it sounds like just more information earlier without having to fight so hard.
Yeah, for sure.
For it.
And I think, you know, you get information from lots of different places, and there was just kind of one clearinghouse, or if doctors or social workers even at the hospital, I felt like the social worker knew somewhat, but they really didn't have time to help me kind of find a placement. It was a bit of a rushed process.
Okay. Questions from our audience for either Tiffany or Dwayne? I know it sounds, I could tell from the show of hands during the introduction at the beginning that this is something a lot of us are dealing with or have dealt with in our own families. Any questions on the caregiver's perspective or the challenges or things that might be useful? Mike, coming to you right over here.
Andrew Carl, I'm a professor at George Mason University, where I specialize in, among other things, what I call NANA technology, which is exactly what it sounds like. It's technology for your grandma. But what we're hearing here is the same thing. People don't know what's out there. So this is important. I developed a GPS shoe. It's a Dr. Scholl's type thing, goes in your shoe, can track you, can locate your mom within 3 feet anywhere on the planet where there's GPS or cellular reception. So we know that there are technologies out there that can help. Look, we're 20 years away from a cure. But I think this conversation highlights that we need to know about the things that are out there in the meantime. So if we can put something in somebody's shoe and locate them, 60% of them wander or get lost. The number one cause of stress in caregivers is fear of the person wandering, getting lost. I did a study with NYPD last year. They're spending up as much as $1 million a month on search and rescues. So everybody's losing here. So I just want caregivers in this audience to know that in the interim, you can be looking at technologies, not just GPS shoe, stove alerts, indoor sensors, robotic medication managers, these kinds of things. So there might be questions, but I just wanted to put it out there that this is the kind of stuff we need to be talking about. How can we help caregivers in the next 10 years, the next 15 years, the next 20 years? And technology is one of the answers.
Thank you. Great point about how a very simple technology like a tracker in your shoe, I could use that for my toddler as well. So multiple applications out there. Another question. Yes, ma'am. Wait 1 minute. We want to make sure everybody can hear your question. Here we go. Right here, right in front of you. There you go.
It's just an idea that came because of your, is this on? Yes, hi, it's just an idea that came, I'm just curious if there's a caregiver, .org or .com or something website where experiences can be, put there, but whoever the manager is or the blogger that's on there can, have a list of how to proceed. I mean, when I went through cancer, certainly trying to navigate the process was just crazy by myself. And, but being a strong-minded person, I managed, but in the end, finding the navigator. And so it just seems so key what you're relating to, and something I experienced with my father. If there was a way to centralize, the results, and by state or by locality, somehow we could have points of call, numbers to call or something. Maybe it hasn't been organized yet, but maybe it can be.
Thank you. Don't know if either of you want to respond to that. I was struck by something you said that I think rings true to so many of us. Just sometimes half the battle feels like just knowing which questions to ask. There's somebody out there, they have the answers, but it's when you're in the thick of it and coping with so many things, juggling so many balls, trying to figure out which question to ask to get help. It can be a challenge in and of itself.
Right, that's why the support group was so helpful. Talking with people who've been through the process,
Yeah.
sharing experiences, what they've been through, that really helped a lot.
Let's see, we have a few. Yep, right here.
I'm Todd Walrath. I work with homecare.com, but I found it kind of striking that, we kick off with Harry's kind of talking about the business of Alzheimer's. We shift to the scientists who are kind of talking about what's going on in the scientific community. But then when we talk about tools and things that are available for caregivers, we have the end users up here, but no one up here talking about what tools are available. We're training 2,000 caregivers just in the Mid-Atlantic here on providing home care service. A third of our families we're dealing with are Alzheimer's and dementia families, and we're looking for tools so that we can better train our caregivers in dealing with dementia and Alzheimer's. Alzheimer's Association has some great things that are out there, but there's really no place. We have staff that just search around on the internet looking for the latest tools, be it how to interact with people with dementia, how to create familiar and comfortable surroundings for them, all of those kind of things. So I'm interested either now or later in learning more about those tools, because I'm trying to get that help out to people like these people, and it's not as obvious as it should be right now in the age of the shared economy and all the other things that are out there.
So the specifics in terms of tools for caregivers and educating them. Thank you.
Yes, good morning. Sandra Charles. As I was listening to the discussion here, several things sort of surged in my mind just by what each person mentioned. One person is talking about giving care in the home. The other person is talking about having to utilize what's out there in the long-term care community. And some of the caregivers that we probably need to focus on as well are those who work in these facilities, to see how they're paid, how they're trained, and what level of, I guess, respect you could say there is for the jobs that they do. Because it's hard to recruit people to work in those situations, to give the quality care that we both expect and require at the rate at which they're paid. So that's a whole new segment that needs to be addressed. And then the whole idea of assisted living, it's not a very well-regulated area. It's not regulated, really. There are regulations for skilled care, but not particularly for those. So they do vary a lot. So from the point of view both of education, awareness, and funding, as has been mentioned, for the disease itself, there's a lot that could be done in all those areas. So you wouldn't be so surprised that Medicare doesn't take care of long-term care, and Medicaid has been used for it, but it's not really what it was intended for.
Thank you. I know that's something that you observed firsthand as you watched your aunt in assisted living and various facilities. People mean well, they don't have the training necessarily to deal with someone who's progressed far along with this disease.
And I think what we saw, I felt like the nurses and the aides that we were working with were amazing in so many ways, and they were also overworked and made, barely more than minimum wage. And I think it says something about our society when our most vulnerable, you think about children in daycare and adults in assisted living, when we pay their caregivers so little, And so I felt like it was really the corporate structure that had issues in not giving training and charging so much, because clearly that wasn't going to the staff. So it was definitely a justice issue there that I felt very strongly about, but at the same time wanting her to be safe and wanting her to have adequate care.
Dwayne, do you feel like your mother is safe when you're not there at home?
Yes, I do, but on the other hand, by keeping my mom home and having what they call a personal care assistant come into the home, each and every time one will come into the home, I ask them, have you dealt with someone with Alzheimer's or dementia? A lot of them would say, yeah, but really, they didn't. So how do you teach a person, when the lady was speaking about training, how do you teach a person to redirect if, my mother gets a little agitated about something? How do you calm them down? How do you, there's a way to communicate with people with dementia. There's a great resource on the Alzheimer's webpage, but I try to tell her my mom's personality, tell her what she likes, so they would, know something a little bit about her.
Treat her as a person with
As a
dignity.
person, exactly. So how do you train that? You just have to be around people and look at the resources available on the different websites, caring.com, Alzheimer's organization. They have little bits and pieces of how to do it.
Okay. We have time for one more question. Yes, sir.
Hi, thank you. Good morning. I'm Chris Breuer. I'm the local chapter president of the local chapter of the Alzheimer's Association. And we think we do a lot of good work in trying to reach out to people with churches and support groups and doctors' offices. We pay for advertising so that people will find us on alz.org. But I'm wondering if you could recommend other ways. It sounds like we're not doing enough, or we're missing it a little bit in having people find us. We are not hiding, but we think that maybe we could do a better job if you could recommend ways that we could be more helpful in being found.
Well, I definitely thought that the Alzheimer's Association was a great resource, and definitely during late night anxious Google searches, the pages had a lot of good information. I think it was interesting to be here and try to navigate another state system, because things are so different by state, and so having to work with the resources in South Carolina. But I also felt like there wasn't one clearinghouse for like, these are all the public benefits that you're entitled to, veterans benefits, Medicaid, different nursing programs, different aid programs. But those are so state and county specific sometimes, so it was hard to find that information.
All right. I would recommend that also. Maybe you can reach out to the different, especially in this region, Office of the Aging. I know PG County has one, Montgomery County as well, and District of Columbia. Maybe you can link up with them so more people would know.
Okay. Tiffany, Stanley, and Dwayne Hughes, thank you very much for sharing your experience with us. Appreciate it. Thank you. I'll head right out here.